Ladies and gentlemen, please welcome co-founder and president of the board, Victoria Reggie Kennedy, and the Vice President of the United States, Joe Biden.
Thank you, and welcome to a very special afternoon at the Edward M. Kennedy Institute for the United States Senate. This afternoon, we are so honored to have back with us an extraordinary man, an extraordinary public servant, an extraordinary friend of this institute and of the man whose name it bears, and I'm proud to say an extraordinary friend of mine. Just a little over 18 months ago, our special guest presided at the opening of this replica of the Senate chamber where we're meeting today. I saw him that day inspire young people from each of the 50 states in our union to be involved citizens, to give back to this great country for all it has given them, to participate in what Oliver Wendell Holmes called the action and passion of our times. He spoke with passion and authenticity that day, as he always does, because he spoke from personal experience. Everyone that day needed only to look to the example of his life to know what it meant to be a citizen who could make a difference. And now we see it again, as our speaker brings us together to discuss what he calls a 21st century moonshot to cure cancer. He understands firsthand the toll that cancer takes on families. So do I, and so does everyone in this room. In fact, I don't know a single person, not one, who hasn't been touched by cancer in some way. The cancer of a loved one, of a friend, of a patient, or perhaps their own. In 1962, President Kennedy explained the decision to go to the moon in a decade in a now famous speech to students at Rice University. He said, "We choose to go to the moon in this decade and do other things, not because they are easy, but because they are hard." He went on to say that the challenge is one that we are willing to accept, one we are unwilling to postpone, and one which we intend to win. Well, we did win it. And 46 years later, in what is my favorite quote from his youngest brother, Ted, Ted said, "We are Americans. This is what we do. We reach the moon. We scale the heights. I know it. I've seen it. I've lived it, and we can do it again." Ladies and gentlemen, with the leadership of our speaker, I have every confidence that we'll do it again with his 21st century cancer moonshot. Please welcome him now, the Vice President of the United States, Joe Biden.
Thank you. Thank you, thank you, thank you. Please. Thank you, please. Thank you very much. Madam President, as we used to say in this body, point of personal privilege. It's really nice to come almost home. I loved the United States Senate. I served there for 36 years. And for the better part of 20 years, I sat right up there next to Teddy Kennedy. And it was one of the great joys and privileges of my life. And the second thing is point of personal privilege, as we used to say in the Senate, Senator, is I truly apologize for keeping you waiting. You probably thought I was Bill Clinton, but I'm not. I was in New York speaking to 120 CEOs on the Moonshot, and they got delayed, and the program got delayed, and then getting out to the airport, and I am so sorry. I truly apologize. You're all incredibly busy women and men, and I thank you for, I assume the reason you stayed is because you don't want to watch the pre-debate stuff on television. Really, thank you so very much. And Senator Rasky, why the hell aren't you sitting at the Delaware desk? You're Hawaii. What are you doing in Hawaii? And Marty, since when did you become the Republican leader of the Senate? Huh? I don't know, this is kind of backwards, guys. This isn't the Senate I used to know. I mean, and the guy in the white shirt all the way in the back, that's where I sat. You're number 100 in seniority. I sat there a long time. All 100 means is nobody pays attention to you. It's such a great honor to be here. And James Carm and the former Senator Mo and Paul, and there's so many people here that I know, and so many I'd like to know better than I do now. When President Obama asked me to head up this moonshot, there were understandably some skeptics out there who said, well, here we go again. Here we go again. President Nixon, well-meaning and truly wanting to do something good, when he declared the war on cancer in 1971, it didn't go very far. But there was a big difference back then. Back then, the president had no army, he had no resources, he had no ammunition, and there was no clear strategy to win. But after 45 years of progress, after decades of funding research, and I'm told some of you in this chamber are among the leading researchers in the world, after training scientists and physicians, treating millions of patients, because of so many of the people in this great city involved in cancer research in the major hospitals of the world, we now have an army and powerful new technologies and tools. And with this moonshot, I believe we have a clear strategy how to move ahead. As every family facing cancer does, our family, like Teddy's with young Teddy, and like with Ted Kennedy, with my son contracted the same disease. You go out and you try to learn as much as you possibly can when someone you adore and love is in trouble. You try to learn everything there is to learn. So maybe there's something out there to hold out some hope. Like Teddy, my beau was diagnosed with a death sentence, stage 4 glioblastoma of the brain. Everyone who's involved in this effort knows that there's virtually no likelihood of surviving that. Several have, but they're not even sure why. I met one beautiful, bright woman, a nurse at Duke University, who was part of that 36-person experiment with the polio virus. She had stage 4 glioblastoma, and she's fine. Finished nursing school. But it's rare, it's rare, it's rare. But without hope, there's no life. My mom, Jean Finnegan Biden, had an expression. She used to say, as long as you're alive, you have an obligation to strive, and you're not dead till you've seen the face of God. So we strive to learn as much as we could. And what we learned from the world's best nurses, physicians, researchers, that even if we couldn't save our son, that science and medicine and technology were progressing faster than ever. And there was the possibility, to save countless others of our daughters and our sons. Because we're at an inflection point. I virtually knew little of this before my son was diagnosed. But 5 years before he was diagnosed, there weren't that many people on the battlefield. Immunotherapy was viewed as sort of a voodoo science, even though a famous doctor at the turn of the 20th century began to talk about immunotherapy and did some experiments and some help. But it wasn't until 5 years ago immunotherapists began to work with virologists and work with oncologists and work with clinical and chemical engineers and geneticists. Back when we declared the moonshot, when President Nixon declared the moonshot, we didn't even understand the human genome. Today, there's a recognition that we're so much further along than we were before. But we're still operating by the same structure and rules that were set down in 1971. The culture of medicine was very different then. The idea of sharing data, there was very little data to share. The idea of the way we provided research grants was very different because there was not much to aggregate. But today, after 45 years of progress, we have millions upon millions of cancer genomes that have been sequenced, tumor tissue, histories of lifestyles, etc. I could go on and on. And we have one other thing. Today, we have a supercomputing capacity that we didn't even fathom in 1971. We can now do 1 million billion calculations per second. And before your term is up, Mr. Mayor, we're going to be able to do 1 billion billion calculations per second through the Department of Energy. It's astounding. But it gives us an enormous opportunity if we can aggregate all this data from all the histories of those who have cancer, survived and didn't survive. We can figure out now, because of this enormous computing capacity, what would take decades for the most brilliant minds to accomplish. You all know somebody, you all know several people who had the same cancer, received the same treatment, the same institution. One died and one lived. Why? We're finding things out. There was one small study done relating to dealing with a particular kind of cancer, ovarian cancer, and there were like 1,400 people. They all got the same treatment, the same cancer. 7 made it. Because it was small enough and it was a concentrated study, what they found out was the 7 who made it all were taking a statin. Didn't have a damn thing to do with cancer. They didn't have any idea why it worked. But they could figure it out. Imagine what we can do because of the technological advances in analyzing cancer genes and proteins called protogenomics. We're much closer than ever to understanding what causes specific cancers and how to attack them. New technologies, new therapies, as I said, like immunology, targeting cancer cells by using your immune system, doing less damage to the healthy cells, transforming many kinds of cancers into chronic and manageable diseases, where 10 years ago they were a death sentence. Now we have tens of thousands, as I said, of cancer genomes sequenced, hundreds of thousands, millions of tumor biopsies, data treatment outcomes, family history, so much more. We didn't have any of this in 1971. And this accumulated important data, but we're still operating with the structures that were set in 1971. And they have to be changed to accommodate 2016 and the circumstance we find ourselves in. And what we found is there's a recognition that the cancer system established in '71 has to be reimagined, reorganized. At its core, the moonshot is about two things. One, injecting, as Dr. King said, the urgency of now into everything we do. And two, changing the system and culture of medicine that existed in 1971 to accommodate the immense opportunities that exist in 2016 in order to be able to win this fight. I've traveled the country and the world since the President of the State of the Union announced I would head up this moonshot, touching virtually every major cancer center in America and around the world, from Australia to Jordan. And the goal of the moonshot is to double the progress we can make against cancer. Due in 5 years, it would take 10. Meeting thousands of cancer patients and their families, physicians, researchers, philanthropists, technology leaders, heads of state, even Pope Francis. I presented to the President on Monday 2 different reports that were called for in the moonshot that he authorized on January 20th. The first report laid out the recommendations of a task force I was authorized to set up when we began. One of the great privileges of being Vice President for President Obama, when he's given me responsibility and authority, I don't have to check anymore. And the reason that matters is when I speak to anyone in the administration, they know I have absolute authority to do whatever he'd be able to do. And so the first thing I did was try to assemble in this task force, which is a task force made up of over 20 heads of cabinet heads and sub-cabinet agencies, and policy councils like the White House Domestic Policy Council, White House National Economic Council, the Office of Science and Technology, the Office of Management and Budget, all of whom were given the charge by me to begin to think through how they could eliminate the roadblocks that exist at a federal level in this fight against cancer. How to streamline our efforts to meet the goal of doing in 5 what will ordinarily take 10 years. That task force was divided into working groups, which reported to me every 2 weeks as to how they were progressing toward that goal. And in the process, we engaged agencies that had never been engaged before. The U.S. Patent Office, the National Endowment for the Arts, EPA, NASA, Department of Energy. Why in God's name were they involved? They have nothing to do with cancer. Yet they have everything to do with the urgency of now. Because as we looked at reorganizing our effort to fight cancer, we realized they all had something to contribute to this urgency. So the task force reported back to me and laid out 70 action points and collaborations they call for, as well as specific changes in how their agencies would do business. You can read it all by going to whitehouse.gov/Cancer Moonshot. But they range from realigning research incentives to be able to move quicker to promote team science, all the way to insisting that all these agencies share all the information they have with one another. The government agencies don't even share the information they have accrued. Breaking down the silos that exist, that impede collaboration and progress. Let me give you a few examples. We launched the National Cancer Institute Genomic Data Commons at the University of Chicago. We have a thing called the Cancer Genomic Atlas that's housed at NIH, which contains the genomes of all the cancers that have been sequenced. And then we have the University of Chicago's Genomic Data Commons to bring together cancer sequencing data and related patient information for tens of thousands of individuals. And what we did, I went out to Chicago and we said, look, you have access to all now, all the data that we have. But in order to give it to you, you have to guarantee us what no other people are doing. Make it instantaneously available to any researcher in the world who wants access to it. thousands of individuals, totally open source. We've already had 5 million. This was, I think, in July. Already 5 million users have gone on to that site. Breaking down silos. The collaboration brings together cancer sequencing data, related patient information from tens of thousands of individuals, with the goal of moving to millions. As I said, this data has already been accessed by 5 million times. The reason to do this, the reason this is so consequential now, in addition to the fact that the human genome didn't exist in '71, we have this incredible computing capacity to deal with aggregated information. So, this holds enormous potential. But so much more has to be done. So we initiated structures to significantly reduce bureaucratic delays in order to speed up innovation. Let me give you just a couple of examples of the 70. The FDA Oncology Center of Excellence, which existed for a long time, brings together cancer expertise at the FDA in order to be able to review all the cancer-related products, from diagnostics to devices to therapies, that are seeking to be used, but the FDA has to approve them. Here's the problem. Science is generating a plethora of potential products, diagnostic devices, and therapies, but they have to be examined first to see whether or not they're safe and effective. But we don't have enough expertise at the FDA to handle these submissions quickly. So potential life-saving therapies are being delayed, at least potential life-saving therapies, months, years. Right now at the FDA, we have 4 separate portals, depending on what you want the FDA to approve. Now they're being combined into one entity. We're also seeking to significantly increase the funding to hire more oncologists and cancer experts to be able to rapidly examine the data to determine whether it can be put in the market to be used, whether it's effective. God willing, this will cut down approval times, identify successful submissions, and save lives. In addition, the FDA is setting up one point of contact, as I said, for hospitals, doctors, therapists, to request a therapy is being considered to be used by what they refer to as compassionate use, last resort. Right now, the one thing you don't want to hear as a cancer patient or a loved one is we're going to go to such and such a drug which has not been approved, but it can be approved for compassionate use. I remember when the doctor walked in very matter-of-factly and said, I guess we're doing, with my son there, I guess we're doing this because this is just compassionate use now. There's not much hope. And excuse another point of personal privilege, almost knocked him on his ass. I was so enraged. But he was right. My son became a trial of one, injecting an adenoid virus directly into his brain, as well as administering anti-PD-1. But here's the point. Right now, even to get permission to deal with compassionate use is time-consuming. And sometimes it works. Sometimes it works. Right now, it takes the U.S. Patent and Trademark Office roughly 2 years to review applications for certain cancer therapies. 2 years. We're providing a pathway now to cut that time in half to a year. The urgency of now. As I said earlier, because we have supercomputing capacity, that allows us to examine enormous amounts of data and find patterns and answers. The national labs, the Department of Energy, have now joined with the world's largest hospital. When I say this to people who aren't as expert as some of you are, they say, you mean that's not already being done? Well, now what we have is the Department of Veterans Affairs is making available the records of over 500,000 veterans to the Department of Energy. treasure trove of information in which they may find patterns and differences that explain why certain therapies work on one person and not another. Look, as all of you in this room know, only 4% of the people who are diagnosed with cancer, 4%, are able to get into a clinical trial. Clinical trials not only yield vast amounts of information, but they save lives. And right now, any of you who are associated with a pharmaceutical company, you know you don't have enough patients in those clinical trials sometimes to run them. We have a system. You can go online now and find out where clinical trials are, where they are. But guess what? It's written in Sanskrit. Really, it's basically useless. Those of you who are in the business, am I exaggerating? It's basically useless. But now, one of the great things the President has done is I've talked to these 200 CEOs today in New York. The reason, as I said, I'm late. I asked them, I said, what would you think if the government, if your company was not able to be able to determine instantaneously where all your customers were by the use of technology you have available to you? I said, there's no way to know where these trials are right now. So we went out, and the President did a really interesting thing. He started what we call the White House Innovation Fellows. Some of the top technology minds in Silicon Valley and up this way, some of the top minds in the world, to work with the National Cancer Institute to develop a website that's transparent and usable. Now, anyone can go to trials.cancer.gov, a totally usable site. It's like going into on your cell phone and deciding what movie's playing in your local theater. You can type in real words like breast cancer and leukemia, a zip code, your age. You can find a list of all the clinical trials that are near you or your loved one that previously were totally unknown to you. You are very fortunate in the Boston community. You have some of the greatest hospitals in the world. But if you live in Butte, Montana, you may have a first-rate oncologist who can diagnose explicitly what your cancer is and have no notion that doctor or you is where to go to get you into a trial. You and your doctor can find out what's available for the particular type of cancer you have. Again, these sound like little things, but there's the urgency of now. In addition to the task force, we set up a thing called the Blue Ribbon Panel. Some of the best minds in the world, all non-government employees, outside experts, Nobel laureates among them, with an express purpose. Identify the scientific areas in this cancer area that have the greatest possibility for significant breakthrough. Larry's heard me say, my dad used to have an expression, when I'd be left home to take care of my younger siblings and something would go wrong, I'd say, but I thought, Dad. And he'd say, Joey, if everything's equally important to you, nothing's important to you. What are the priorities? Where should we be focusing our attention down the road beyond these 70 recommendations? Ladies and gentlemen, these are some, as I said, the best minds in the world. A number of from up in your neighborhood here. And so what's happened is we've laid out, as a consequence of that, and you can read that report by going to whitehouse.gov/cancer, moonshot again. All this is designed, as I said at the outset, to change the structure of how government organizes its efforts to tackle cancer, knowing the answer ultimately is going to lie in the private sector, and what scientific priorities we should be tackling and in what order. There was one other thing I did for the President at the Moonshot call for on Monday. I presented him with President George H.W. Bush is a quintessential gentleman, by the way. He is a truly fine guy. But I kidded him when I was talking about it. I was down at MD Anderson at Rice University, and he was there, and I kidded him. I said, you know, Mr. President, it's this vision thing. Remember his comment, the vision thing? Well, there's a vision thing. What do we focus on going forward? And it was titled The Vice President's Report, Executive Report to the President. And what it incorporates is what my experience has been the last 10 months going around the world. The report not only includes what we're now doing, but also what we need to do in the future. For example, one of the things we have to do in the future, we're not doing nearly enough on now, is enhancing prevention efforts. All of you experts know that it's estimated that 50% of all cancers could be avoided if we engaged in prevention. But people think of only prevention as talking about not smoking, watching out for your weight, all those things that relate to lifestyle. That's one area. But there's a second area. There are an awful lot of people in America that don't have access to the existing technologies to detect whether or not there's cancer. Breast cancer machines, lung cancer. So we have to significantly increase what we're doing in terms of making it available to disadvantaged populations. Because we all know the earlier the detection, the better the outcome. It's a form of prevention, preventing deaths. The government has an obligation. The government has an obligation to deal with carcinogens in our air, our soil, our water, which are a significant cause of cancer and can prevent its occurrence as we clean the air and the water and the soil that's been contaminated. But there's one last area that is exciting and promising, and that is new technologies, totally new technologies that are on the cusp of being available. For example, as I visited everywhere from the Hutch to MD Anderson to Duke, a number of these great research hospitals are working on blood biopsies. The cancer that you may have inherited, propensity to it, the cancer that takes a long time to grow, like colon cancer, the cancer that can end your life by the developments that are going on now, these blood biopsies, just like when your child goes in to get their vaccination for school, and they have a blood test, you can determine whether there are certain markers in your blood. They're making enormous progress. For example, if it turns out you have the marker for colon cancer, which can take up to 20 years to develop, you don't wait till you're 48 to do your first colonoscopy. You get one when you're 18. And you get one every couple years, two a year. So you never get to the point where that polyp develops into a cancer. They've made great progress in hereditary cancers by tests that can be done now to determine whether you have certain kinds of cancers in your body based on hereditary propensity, and take precautions now to deal with it. These liquid biopsies and non-invasive mobile imaging techniques. For non-scientists like me, I find it absolutely incredible and exciting that a marker in your blood can tell you whether or not you have a particular cancer or whether you're predisposed to get one. You may have a tumor in a place that's too dangerous to go in and excise, to diagnose, but it may be benign. You can tell by the marker in your blood whether that tumor is benign or not, saving you from an invasive operation that could do significant damage. There's so many things that are on the cusp if we invest. I don't have to make the case to all of you why this is important, but engaging more patients in research to increase the percentage of patients that are enrolled in clinical trials not only gives them more access, but it cuts the time. We're cutting the time and the cost of the clinical trials, expanding the criteria that allow you to get into a trial, which is very, very narrow right now. We did an interesting thing, and I asked my staff to hold what they're doing, but we've done a very interesting thing. We found that there are a lot of drugs or therapies that are available are better used in combination with other therapies. But drug company A has a particular product, and drug company B has another one. A young or brilliant researcher says the combination of those two would work very, very well, I think. But they can't get permission from the drug companies to use them up till now. Dual-use drugs, too. Because some of it totally legitimate. Company says, if there's a problem that develops, am I liable? And secondly, they say, if this results in a cure, am I going to benefit for all the research I did? Right now, you go into a place and you put money in a jukebox. You don't have to negotiate with Britney Spears whether you can have a license agreement to play her song. It's already negotiated. Well, what we've done now, we pre-negotiated all of this. So, initially only 9 drug companies are taking all the drugs they have available that have not been patented yet, laying them out on the table for any researcher to be able to use in combination. Start off with 9, now we're up to 20 drug companies doing it, with thousands of different therapies. These brilliant young scientists are coming along and they're using them in combination. Why? We've worked out a pre-licensing agreement. So if in fact it does work, they are going to get a commensurate share of the benefit that flows from that, the financial benefit. These are very practical things that can absolutely speed up significantly the sharing of data and information that has been withheld so far. Expanding access to care and cutting cost of care by reaching communities across the United States with new breakthroughs in technologies, outcomes that are wholly dedicated to something other than your zip code. New payment methods that reward quality of care, not quantity. Making sure insurance coverage decisions are not rooted in what works for a particular patient. Coordinating worldwide cancer moonshot efforts. As I said, I just at the UN General Assembly, I signed 9 memorandums of understanding, actually 10, with countries from the Middle East to Asia, Europe, North America, an agreement to share genomic data, protein data, on hundreds and hundreds of thousands of patients. We had the conference on nuclear proliferation at the White House, 50 heads of state in the East Room, Vicki, and all the tables lined up, you know, and long, in a big rectangle. 50 heads of state. President sitting in front of the fireplace and me directly across with my back to the Grand Hall. And he starts off by saying, quote, I think I'm paraphrasing, I know you all want to talk to Joe about cancer, but let's deal with nuclear proliferation first. Not a joke. As I think Paul would acknowledge, I have some alleged expertise in foreign policy and national security. I got sent to the UAE to meet with MBZ and his security and intelligence people to deal with Daesh or ISIL. We're sitting out on the Persian Gulf under this tent at night. You know, all his security people, I have my security people with me in the White House. And he starts off and says, before we begin, Mr. Vice President, can we talk about cancer? Can we talk about cancer? If we don't begin to aggregate, share, coordinate this effort better, it's predicted that there will be over 20,500,000 new cases of cancer by the beginning of the next decade. 16 million deaths. And will continue to increase exponentially because cancer is coincident with age as well. And this week we added 35 new public and private commitments. For example, Microsoft and Amazon have stepped up, said they'd partner with the National Cancer Institute to use their cloud computing capabilities to store genomic data for tens of thousands, potentially millions of people, and able to be accessed and researched by all researchers. For those of you in the business, that's a pretty significant change. All of you brilliant scientists, doctors, research advocates, you know we're just getting started. Most of all, these reports to the American people share a story of the spirit of discovery that defines, no one could have said it better than the way Teddy said it, defines this country. Well, it gives me every confidence in the world that we're on the cusp of enormous, enormous, enormous progress. One of the other reasons why I said what I said when I announced I wasn't running for president, it was spontaneous. When I walked in the Rose Garden, I said I have one regret. That I will not be the president to preside over the end of cancer as we know it. Well, for the first time in my career, someone's given me an assignment in an area that I know less about than my staff. I'm not being facetious. This is a daunting, daunting area. I've spent 9 months trying to learn everything I possibly can, and I still have so much more to learn. But the one thing I know, this country has the capacity to do anything. I mean it literally, anything it sets its mind to. This is not a political statement. It's a personal statement. What bothers me, the difference between when I sat in that seat 100 in the Senate, American people believe there wasn't anything we couldn't do. There wasn't anything we couldn't do if we set our mind to it. But today, we're talking about woe is me. What can we do? How can we get our arms around our problems? And that's the second reason I said what I said about the moonshot. When we make this significant dent in cancer and save millions of lives, it's going to reinforce in the minds of the American people we can do anything. We're on the verge, as all of you know, of some astounding breakthroughs. Your grandchildren are going to be traveling subsonically at 22 to 23,000 miles per hour. I promise you. We're on the verge of changes brought about by digitalization that will absolutely take your breath away. Do in the next 10 years what took 50 years to do before. And I'm absolutely convinced if we set our mind to it, we can give as the first example of that this new battle against cancer. Earlier this year, and I'll conclude with this, I spoke at Rice University. Secretary Baker invited me to speak. There were 4,000 people there, the Baker Institute. We spoke on the same spot that President John Kennedy spoke, almost to the day, 2 days earlier he spoke, when he made his moonshot speech to the American people. In a bizarre sense, it was a little bit easier because there's only one moon. But there's 200 distinct cancers that we didn't know existed in 1971. 200 totally distinct cancers requiring fundamentally different therapies. And you know the words. He said, "We choose to go to the moon," as Vicki said, "in this decade and do other things not because it's easy," and went through it. But the operative phrase he used that applies to this moonshot, he said, "Because the challenge is one that we are willing to accept and unwilling to postpone." Unwilling to postpone. That's where we are today with the Cancer Moonshot. My overall objective is to accomplish two things. Make clear that the United States of America, the public and private sector, is unwilling to postpone the cures for cancer. There's thousands upon thousands of brilliant researchers spending nights, weekends in their labs, looking at the next breakthrough, countless patients full of courage, hoping they can return to their lives and their families, asking for just a little more time. Some of you in here are docs. Some of you in here are clinicians. How many times have you heard the words, and I'm not exaggerating, Doc, can you give me just 6 more months? I know I'm going to die. But give me 6 months. Because if I have that time, I can reorganize my company. And when I die, my family will be okay. Doc, can you give me 1 more month? Because I want to walk her down the aisle. Just give me 1 more month. I don't expect you to save my life. 1 more month. Give me 3 weeks, Doc. I want to see him graduate. It's been such a struggle for him. I just want to see it. My firstborn's going to have a baby, Doc. It's due in 10 days. Can you just get me through 10 more days? That's the reality of cancer. That's the reality of the urgency of now. So if any one of these things we're talking about, and so much more on the horizon, speeds up by a month, a year, 2 years, or 3 years, it is really consequential. Really consequential. We have the best minds in the world here assembled. And I'm not being solicitous, an awful lot of them right here in Boston and the suburbs. And, I joked, and I'll end with this, I joked, when I was a freshman senator, it was actually 4 years in, it was during Watergate. There was a guy who sat one row ahead of me, with a gentleman in the red tie sitting. His name was Lawton Childs. Walking Lawton was his name, because he walked from down in the Everglades all the way up to almost into Georgia and then the entire panhandle. And I called him Walking Lawton. He didn't raise any money, but he won an election. A smart guy, went on to be governor. And right in the middle of the Watergate scandal, he and I were on a committee, the budget committee, and we got in the subway, Paul, to go over to vote. And the subway, many of you have been there, has a plexiglass window on it in the front seat. We were in the front. And it pulls up to a set of escalators to go up to the elevators to go up to the Senate floor. And as we pulled up and it came to a stop, he looked up, and Ben Bradley and the Watergate boys were there, standing down looking at us. Woodward was looking particularly hard at Lawton. And Lawton turned to me and he said, Joe, why do I get the feeling that they're looking at me like I'm a Pulitzer Prize about to be won? Well, there are a few, but not that many, brilliant cancer researchers who walk by the mirror and say, I'm looking at a Nobel Prize that's about to be won. That's why there's not a lot of sharing going on, in part. You realize if you got a grant as an astrophysicist for $50 million to study the third ring of Saturn, you'd have to publish your results the moment your report was finished for the whole world to see. You come and you ask NIH for a grant of a similar amount of money to study proteins on cancers, and you succeed or fail, you don't publish. You wait for some prestigious journal like the Harvard Medical School or other places, and you publish. You publish in a single name. You don't publish with anyone who helped you, because that's the method. That is the incentive system. And if you fail in clinical trials, you're supposed to be able to publish immediately your results, but they don't. As a Vicky, in conclusion, I think Teddy might be proud of me because I had the authority. You know what I did? If you have to publish under the law and you don't publish the moment you finish your study, there will be a $10,000 per day fine every single day until you publish. This is if you don't publish, you're going to perish. So folks, use your influence with all these incredible people who are totally dedicated to changing people's lives, to begin to make medicine what it wasn't in 1971. Make it a team sport. Collaborate, cooperate, because therein lies the answer to how rapidly we get to the place where we're beginning to change millions of lives. Madam President, I yield the floor. Thank you.